It's the moment you've been waiting for, your baby's arrival. The anticipation has been building up for months, and now the big day is almost here. As you get closer to your due date, your body will start giving you signs that labor is near. These signs can be subtle or quite noticeable, but they all indicate that your baby is preparing to meet you. It's exciting and maybe a little nerve-wracking, but understanding these signs can help you feel more prepared. Knowledge is power, and being informed can ease some of the anxiety you might be feeling. Remember, every pregnancy is unique, and so is every labor experience. What you experience might be different from what others have gone through, and that's completely okay. Your labor might be different from your friends, and that's perfectly normal. Each journey to motherhood is special in its own way. The most important thing is to be informed and stay in close contact with your healthcare provider. They can offer guidance and support tailored to your specific needs. This is a journey you and your body are on together. Embrace the changes and trust the process. Let's dive into some of the signs that your little one is getting ready to make their grand entrance. From early contractions to the breaking of your water, we'll cover it all. So, how do you know when it's showtime? How can you be sure that your baby is ready to make their grand entrance into the world? Your body has some pretty amazing ways of letting you know labor is on its way. It's like your body has its own unique language to communicate with you. Here are some of the most common signs that labor is approaching. Contractions. These are tightening sensations in your abdomen that come and go. They are your body's way of preparing for the big event. At first, they might feel like menstrual cramps or pressure, but they'll get stronger and more regular as labor progresses. You might even start timing them to see how close together they are. Water breaking. This is when the amniotic sac surrounding your baby ruptures, releasing fluid. It's a clear sign that labor is imminent. It might be a gush or a slow trickle. Either way, it's time to get ready to meet your baby soon. Bloody show. As your cervix starts to dilate, you might notice a thick, pinkish mucus discharge. This is your body's way of showing that things are progressing. This is totally normal and a good sign that things are moving along. It's a signal that your body is getting ready for labor. Pelvic pressure. As your baby descends into your pelvis, you'll likely feel increased pressure and even some discomfort. This is your baby getting into position for birth. Back pain. Some women experience back pain as a sign of labor, especially if the baby is in a posterior position. This can be quite uncomfortable, but is a common part of the process. Remember, every woman's labor experience is unique. Listen to your body and trust the process. You're about to embark on an incredible journey. Knowing when it's time to grab your hospital bag and head to the hospital can be a bit confusing, especially for first-time parents. It's important to recognize the signs that indicate it's time to go. Here are some guidelines on when it's definitely time to go to the hospital. Regular contractions. If your contractions are coming at regular intervals, about 5 minutes apart, lasting for a minute each, for at least an hour, it's a strong sign that labor has begun. At this point, it's time to call your doctor and head to the hospital. Water breaks. Whether it's a gush or a trickle, if you think your water has broken, it's crucial to act quickly. Contact your healthcare provider immediately for further instructions. Severe pain. Labor is hard work, but if you're experiencing unbearable pain that you can't manage, don't hesitate to call your doctor or midwife for guidance and support. Heavy bleeding. A small amount of blood-tinged mucus is normal, but if you're experiencing bright red bleeding, it could be a sign of a serious issue. Call your healthcare provider right away to ensure everything is okay. Decreased fetal movement. Your baby should be moving regularly throughout your pregnancy. If you notice a decrease in movement, it could indicate that your baby is in distress. Contact your doctor or midwife immediately to get the necessary care and attention. Trust your gut and your healthcare provider. Remember, you know your body best. If something doesn't feel right or you're concerned, don't hesitate to reach out to your healthcare provider. They're there to guide you and answer any questions you might have. It's better to err on the side of caution and call your doctor or midwife if you're unsure. They'd much rather hear from you than have you worry unnecessarily. You've got this, mama. Listen to your body. As you move through the final stages of pregnancy, pay close attention to your body's signals. It's easy to get caught up in due dates and schedules, but your body will let you know when it's time. Don't be afraid to ask for support from your partner, family, or friends. Having a strong support system can make a world of difference as you navigate the journey of labor and delivery. You've got this. Labor and delivery are incredible experiences, and you are strong and capable. Trust your body, communicate with your healthcare provider, and before you know it, you'll be holding your little one in your arms. Remember, this is just the beginning of an amazing adventure.